Well, February kicks off Women Heart Health Month, a time to raise awareness of heart disease in women, which is the leading cause of death for women.
Our 9 Health expert, Dr. Payal Kohli, joins us now to talk more about this. Thanks for coming in.
Good morning. Happy Heart Month.
Yes. So what are some of the risk factors that women should be aware of for heart disease?
You know, it's hard being a woman because we have all the same risk factors as men: high blood pressure, high cholesterol, high blood sugar, obesity, sleep apnea. But we also have some specific risk factors to us that are related to our reproductive life cycle. So the age at which we started our period, how many pregnancies we carried, how we carried those pregnancies, if there are any complications like preeclampsia, gestational hypertension, and then when we hit menopause. So if we hit menopause early, that actually puts a target sign on us that we're going to develop heart disease early. Yes. So it's really important, and I always tell all my female patients this: when you go to your doctor, it's not just about your cholesterol, your blood pressure, your blood sugar, but as a woman also all about what's called the cardio-ovary history, how your reproductive life cycle was.
So how can heart disease manifest itself differently in men versus women?
We're still trying to understand the hormonal influences on heart disease, but we know that women get blockages in the highways of the heart, just like men do. That's what causes heart attacks. But we as women also get blockages in the side roads, the tiny little blood vessels. And these are blockages sometimes that don't always show up on tests and can manifest with symptoms. We also know that as we age as women, our hearts tend to get smaller and stiffer. So we can get a type of heart failure that's called a stiff heart syndrome, or HFpEF, where the heart becomes small and stiff, and it can cause problems with electricity, problems with swelling in our legs, and shortness of breath and such.
You mentioned some of the risk factors, and you said early menopause can be an indicator, and you mentioned menstrual cycles and when those start as well. So if you start early, is that an indicator? Is it early?
So the reproductive life cycle, so if we have a very late onset menarche when our period starts, or early, or we start our menopause too early. So for example, our estrogen turns off too early, that protective effect of estrogen goes away on the blood vessels, and it can confer risk.
If you like guidelines like myself, what is the threshold for early?
So I would say for a woman in the U.S., probably before the age of 55. If you've had either surgical menopause, where you had your ovaries and your uterus taken out, or you've had medical menopause, meaning that your ovaries just kind of shut down, you really want to talk to your doctor about whether or not hormone replacement therapy makes sense, because the idea is the body is sort of designed to see that estrogen until about 55. Now, post-menopausal hormone replacement therapy, where you stop having your periods at 55 or 60 and then take hormones, can actually confer more risk.
Really?
So it's a really complicated situation where every woman's decision has to be individualized.
So there are a lot of things that are kind of out of our control, right? It's like whatever our bodies are kind of deciding, or our history, but what can we do to lower our risk for heart disease?
80%, Corey, of heart attacks and strokes are preventable with risk factor management. So I would say the opposite. Most of the things are in our control. The first and most important thing is know your numbers and know your risk. And it's never too early to get started. So people say, I'm in my 20s, I'm in my 30s. You start to put down plaque or cholesterol deposits in your arteries in your 20s. And once they go down, they're never coming out of there. So you really want to make sure you start minimizing those risk factors early in life, because it's what we call area under the curve. Lifetime exposure to cholesterol, which is a toxin to our arteries, leads to accumulation, and then it declares itself in our 50s, 60s, and 70s.
Okay, but really quickly, once you do get a blockage, is there a chance for that to go away?
No.
No. Okay.
No. And here's why. That's why every single one of us this month needs to go and get our blood test checked. If you're over the age of 40, get an x-ray called a calcium score. Make sure you get your blood pressure checked, because the idea here is to prevent those blockages from occurring. And I'm not just talking about heart blockages, brain blockages that lead to dementia and stroke, which are things we worry about, blockages in other blood vessels that lead to conditions like erectile dysfunction. These are all preventable things. We worry about them, they're preventable. And if we take control of our risk factors, we can really make a difference.
Okay.
Really important conversation. Dr. Kohli, as always, thank you so much for coming in. And you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.